So now it's time for Ansley Bevan, who is right there. So, Ansley Bevan is founder of AB Equine Therapy and Equine Wellness Education. She's a FEI permitted therapist, certified equine rehabilitation practitioner, licensed massage therapist, and creator of the movement feedback method, and international clinician. She will talk about the residual effects of hyperflexion in the equine body, and she came all the way from Florida for this. Thank you very much, Ansley.
Thank you. Hopefully I can get my slides to work okay. So I'd just like to say that it is a privilege to be here among like-minded equestrians and professionals who are working towards positive change in our industry. We are here today to discuss hyperflexion, the effects that it has on the equine body and mind, and to come to productive solutions on how we can implement change for this unethical practice. I appreciate your attention for the next few minutes while I share some of my views and findings. Hyperflexion is a sought-after training technique for professional riders and amateurs alike. I think we can all agree that for the most part, riders and equestrians do love their horses and have their best interests at heart. However, equestrians who are competing also love to win, and as we all know, this can lead to questionable practices at times. Unfortunately, hyperflexion has not had enough adverse effects publicly, meaning equine governing bodies have landed in a bit of a gray area as to how harshly they would like to categorize this training technique. This has allowed the usage of hyperflexion to continue even at highly publicized show venues and at the uppermost levels of our sport. Unfortunately, I believe that it is easier for riders to ignore the ethical aspect of matters when they are reaping the benefits of winning competitions, moving high-dollar sales horses, and achieving their riding goals. Until prominent riders, show venues, and governing bodies truly choose to take a solid stance and enforce policy on hyperflexion, it will be difficult to eliminate this practice within the equestrian industry. Unethical training techniques should not be rewarded, they should not be glamorized, and they most certainly should not be normalized. To many of us here today, I'm sure we can all agree that there are countless negative effects that hyperflexion has on the equine body and the mind, spanning from elevated stress levels to anatomical and biomechanical dysfunction. In this presentation, I'd like to share a small example of how hyperflexion affects the equine body, specifically breathing mechanisms and foreleg movement. I'd first like to go into a brief overview of the respiratory system of the horse. There we go. So you can see here, we have a picture of the, let me not get you in the eye, sorry, of the upper respiratory system of the horse. You can see the pharynx and larynx outlined here in this first image, and as well as the trachea. So horses are obligate nasal breathers, meaning they breathe through the nose and not the mouth, unless the horse has an anatomical abnormality or a pathology that prevents them from doing so. This is key information when looking at how the upper respiratory tract functions. For the horse to breathe efficiently, all of the structures and associated muscles need to work in an uninhibited way. They need to be able to relax and contract, allowing the proper passages to constrict and dilate in order to move airflow properly and oxygenate the body. So when you're looking at the pharynx and larynx, these are two key structures that make up the horse's upper respiratory tract, along with the nasal passages, the nostrils, and the trachea. One of the functions of the pharynx is to deliver air from the nasal passages down into the larynx. The larynx then serves as a channel for the air as it passes from the pharynx into the trachea. The function of the larynx is especially prevalent during exercise. Any laryngeal or pharyngeal dysfunction will contribute to inadequate ventilation. So, two very important findings here. One, a decrease in pharyngeal diameter will limit the airflow that travels through the upper respiratory tract. And two, multiple studies have shown that pharyngeal diameter was found to decrease during a hyperflex position. And this is something that I believe Alice touched on earlier from some of those findings, that the pharyngeal diameter is absolutely decreased when the horse is in this hyperflex position. And like we saw earlier, you can see how closely affiliated all of these structures are when you have this hyperflexed angle of the head and neck. This means that the airflow through the upper respiratory tract is compromised when the head and neck are in the hyperflex position. So in summary, the pharynx and larynx work together as part of the horse's respiratory system. Hyperflexion decreases pharyngeal diameter, which results in decreased airflow. This means that the horse's respiratory system efficiency is directly impacted by hyperflexion. So in this next segment, I'd like to draw your attention to specific muscles that correlate with several regions to include the tongue, the hyoid, respiratory, and thoracic region. So we have a little bit closer up of a viewpoint of some of these muscles we're going to talk about here. Muscles such as the hyoglossus, thyrohyoid, and genioglossus not only correlate with both the tongue and the hyoid, but they also contribute to laryngeal and pharyngeal function, meaning they play a role in respiration. Several of these muscles share attachment sites at the lingual process here, which is part of the hyoid bone and the tongue. So it is important to understand that the muscles that attach and interact with the tongue and the hyoid will be affected by anything that causes tongue and jaw restriction. As you can see, that makes a lot of sense, having these muscles attached to the lingual process, the hyoid bone, and how closely they're affiliated with the pharynx and the larynx and the trachea. The movements used to keep the horse in the hyperflex position place substantial pressure on the tongue and jaw, therefore contributing to tongue and jaw restriction. We're going to revisit this concept in just a moment. Before that, I'd like to talk about 3 more muscles. There we go. The next group I like to showcase consists of the sternohyoid, omohyoid, and the sternothyroid. And these 3 are going to be here. These 3 muscles are unique. Unlike the last group, which were localized at the head, these muscles run from the cranial region down into the thoracic region. So these muscles insert at the hyoid and they originate down at the chest. So we have origin sites in the thoracic region to include the sternum as well as the subscapular fascia, which is here at the shoulder. So sternum, shoulder, all the way up to the hyoid here. When we look at the dynamics of hyperflexion and how it is achieved, you can see that there is forceful, prolonged pressure on the bit, which puts pressure on the tongue and the jaw, resulting in restriction of the tongue, the jaw, and the hyoid. With restriction comes tension, and with tension comes dysfunction. So now let's revisit the concept of hyperflexion restricting the muscles that attach to the tongue and to the hyoid. What does this mean for the muscles that run down from the mouth into the chest? We now have a chain reaction of dysfunction stemming from the occiput, affecting the respiratory tract all the way down through the cervical region to the scapula, foreleg, and sternum. So the tip here would be the occiput, hyoid bone coming down, affecting the tongue. We talked about these respiratory system features here going down into the chest. You can see how these closely interacting muscles and structures are codependent on each other to operate efficiently. So when we limit the diameters of airway openings and we restrict muscle function, jaw, and tongue movement, it becomes obvious how clearly hyperflexion inhibits performance. The action of hyperflexion alters the horse's anatomical structures in a way that they cannot perform optimally. Through distorted head and neck position and immobilization of the tongue and jaw, hyperflexion affects breathing, it can affect foreleg movement, it can cause tensional patterns among all associated musculature, it can exacerbate any currently existing upper airway disorders, and most importantly, it negatively affects the horse's welfare. In my therapy practice personally, I've seen the residual effects of hyperflexion manifest themselves in many ways. I've witnessed high-performing horses develop anxious patterns in association to tacking up with the bridle and bit. I've seen horses with previously quiet mouths develop overactive tongues and restless jaw movements. I've seen horses develop negative associations with the bit, resulting in head shaking and exacerbated hyperflexion to try to escape bridle and bit pressure. I've seen horses fall into compensatory movement patterns affecting their foreleg movement, cervical, and thoracic engagement. I've also seen horses altogether disassociate, shutting down due to stress, discomfort, and the pattern of exploitation. In my field, we recognize the vast connections throughout the equine body. You cannot expect a training technique such as hyperflexion to not produce harmful outcomes on both the body and the mind. This training technique has no place in an equine industry that hopes to deliver ethical results. I hope that the small examples that I've shared today portray just how large of an impact hyperflexion truly has on the horse. I'm thankful that there are those in the industry who are dedicated to creating positive change. I'm grateful to be part of this conference. Thank you so much, Eva, for having us all here and putting it together. And thank you so much for your time and attention. I know. I also wanted to say, if anybody is interested in some cited works that contributed to the presentation, I have that available if you'd like.
Are there questions for Ansley? Yes, Karine Lebrand, veterinary.
Yes.
Thank you very much for this wonderful explanation. Could you share a few words about the changes in the movement pattern of the front leg in hyperflexed or roll-cure position?
So, personally, a lot of times I will see it will be irregular movement, so asymmetric. I believe some of it we saw in one of the videos that Eva showed. You could see it might have been the left fore on one of the horses in the warm-up. A lot of times when you see that restriction coming through the cervical muscles and the head, it will translate into the forelegs in shorter, choppier strides, or asymmetric movement is what I see a lot. I mean, that's just localized to the forehand. A lot of times you will see a lack of engagement throughout the thoracic and lumbar as well, which somebody else touched on, where it would affect the hind leg movement as well. So that's just something that I see a lot in my practice.
Thank you.
Thanks.
So it's not only a question for you, but it's also for the people who spoke before you. You're all talking about the damages that it does on the horses. If we stop using hyperflexion, can the horse recover and become a normal horse again?
That's a good question. I think
how much time?
Yeah, I think to answer that from a scientific standpoint, we would need more evidence in the long-term effects and studies to find out how quickly and effectively the horse could recuperate. From a muscular standpoint, though, I mean, yes, you're able to have regeneration and rebuild the muscle and the asymmetries through therapy and rehabilitation. And if you eliminated the catalyst, being hyperflexion, yes, I would assume that they could. If they had, the stress factors and more of those things, obviously that's a longer term damage but again, we don't know how much of that is directly isolated, to hyperflexion. So, thank you. Oh, sorry.
So there is a question from someone here, from Alice, from online. What about arthritis in the neck, C2, C3? Do you see that often in your practice?
So to see the arthritis, you'd need to do imaging. And again, to pinpoint that directly to hyperflexion, we would need studies, that had the right variables involved to prove that. But I will say in my practice, yes, I do find horses that are ridden in hyperflexion, and we say broken at the pole. So you have that severe hyperflex position, the C1, C2, C3. I do find horses irritated muscularly. So as well as the nuchal ligament. I mean, there can be a lot of sensitivity and tension at the pole in my therapy practice. Like putting your hands on the horse, you will notice a lot of them will be head shy and they will carry tension there. They'll also carry tension, the jaw, the TMJ, and I'll have to treat a lot of the attachment sites coming up under to treat the attachment sites of the hyoid all the way down to the cervical and those attachment sites in the thoracic region that we talked about as well. Oh, okay.
I wonder, when these people call you, they have been using this hyperflexion technique. So you will say, okay, I feel this and this is a bit tense and all. How can you get the message through to these people without getting them so angry that they don't call you again later? How do you do that?
Well, I'm not going to lie and say that hasn't happened, because there have been some visits where it was just one time. They didn't like the information I had to share. But I will say it's walking a fine line. You're walking that balance between, hi, I'm presenting this issue to you. You might have to modify the way that you ride and the way that you train, and it really becomes the ball is in their court. Do they want to put the horse's welfare above the trainer's opinion, or the next show that they're preparing for? It really comes down to the individual and how they feel and what kind of rider and equestrian they would like to be. And I'd say it's 50-50. I have a lot of people that are very open and responsive to it, and they weren't aware, of the more detrimental effects or long-term effects or how deep it really goes. Whereas others, it's in one ear and out the other, and they're just kind of, okay, thank you, So it's a little bit of both, I'll say.
How are your colleagues in Florida? Because I have no idea. I know very well how it goes here in France, but I have no idea how this information is taken and known already in Florida, and how your colleagues, massage colleagues, and all these people who are working, body workers, as we say, how do they accept you or not? Or are there many people like you, or are they still very...
I would say in the industry of the osteopathic and chiropractic, body workers, massage therapists, we're all kind of in the wellness game. We try to work towards that together. I will say there are some who are more geared towards the results in the show ring versus the other ones that are truly more horse welfare oriented. Where I live is kind of unique in Florida. There's larger show venues kind of surrounding me. There's a large dressage venue down in South Florida where obviously we see a lot of the hyperflexion and a lot of the show jumpers that when it spans into show jumping, it'll be due to the training aids. So a lot of the German martingales and the draw reins and things like that. So you do see it in show jumping as well. We have something called the hunters. I don't think you guys have that here. Yeah, which I wouldn't say it's so prevalent there because that's more of they want the relaxed posture, but it is apparent everywhere, and it's hard to kind of share that opinion. Once you get closer to the show circuit, it's harder to be more vocal because, they care about the results, they care about the competition, more so than the welfare, I would say. It's so similar to here, I imagine. Yeah. Yes, unfortunately. Thank you so much.